I'm here with Rico, who has bilateral knee pain, and we're going to do a Durolane injection in both his knees. On his left knee, we're going to do the suprapatellar pocket from the lateral portal, and on his right knee, we're going to do the parapatellar pocket from the medial side, which is midway up the patella. So let's start by scanning Rico's knee. We notice first off, there is no effusion. Let's increase the gain a little bit. Okay, and we are right there. All right, so what I'm looking for here is the suprapatellar pocket. And in Rico's case, it's very, very small and not super obvious, but it is there. And so we are looking at about 2 centimeters depth. And let's switch into short axis. And so I'm going to toe in a little bit, and I'm just going to confirm in long axis that I'm in the right tissue plane. Right there, too. Okay. All right, so for Rico, I'm going to have to inject quite close to the proximal end of the patella to be comfortable getting into the knee. If we go too far proximal up into the suprapatellar pocket, I'm concerned that we're going to just put the Durolane into fluid. Okay, Rico, here we go. You're going to feel a small poke, so I'm toeing in a little bit. That just opens up some extra space for me. I'm going to come down 2 centimeters. 1, 2, little poke here. I'm going to feel some pressure as I inject the local, tender, and there's our needle right there. Okay, I'm going to add a little bit of fluid just to see if I can bulk up that space a bit. How are you doing, Rico?
Good, very good.
Okay, there we are right there. And I'm going to reorient my needle. You okay?
Yes.
Okay, you can see it filling right there, and I'm right just at the top end of that space. Okay, I'm happy with that. Touch of the needle, this should be numb. You still good?
Yes.
A little bit uncomfortable, hey?
Yeah.
This is because I'm right close to the proximal end of, see how I came a little low there, and I was up against the lateral condyle of the femur, and that's what caused him some discomfort. So now I'm in long axis, and you can see the tip of the needle is right there. I'm injecting right now, and it's important to always inject in long axis when you're injecting with the suprapatellar pocket, because in this position you can see fluid accumulating if it's not flowing into the joint. And I'm pressing. Are you okay? Yeah. There's no fluid accumulation there. There's the tip of the needle. There's absolutely none, which means all of it is just advancing into the knee joint. Okay, and as you get close to the bottom, make sure you bottom the syringe out. There we go. And there's the fluid pocket that accumulated. So now we can see the distended suprapatellar pocket now that we've put some fluid into it. So I was absolutely in the right cavity. We injected 3 milliliters of Durolane, which is a cross-linked hyaluronic acid that acts as a shock-absorbing, anti-inflammatory, very slippery substance that is naturally found in knees, and as knees age or become diseased, the amount of hyaluronic acid decreases. So this is an injection to replace that hyaluronic acid, and patients can expect anywhere from a very poor result with no benefit to up to 6-8 months of relief with a single Durolane injection.